Hi, and welcome to this edition of Fresh Hope for Mental Health. Our mission here at Fresh Hope for Mental Health is to empower you to live well in spite of your mental health challenge by sharing insights through interviews, practical tools for living well, encouragement, and courage for overcoming all from a Christian perspective. And now, here's your host, Pastor Brad Hoefs.
Hi, everybody, and welcome to this edition of Fresh Hope for Mental Health. I'm Brad Hoefs, your host, and we have this special edition in the sense that we're both doing a video as well as we're doing audio today. And I have with me Dr. Jocelyn Babbitt, and I got to get used to a new last name for Jocelyn. But Dr. Babbitt, thank you very much for being with me today. I appreciate it.
Yeah, you're very, very welcome. Glad to be here.
You work as a general practitioner in the hospital, right? You're a hospital staff doctor, correct?
Yes. So I'm a hospitalist. Yes.
A hospitalist, that's what it's called, huh?
Yep.
I didn't know that. Well, learn something new, huh?
Absolutely. Yep.
Well, I asked Dr. Babbitt to be with us today to talk with us about the mental health strain on caregivers right now who are caring for COVID patients. And really, I suppose all of the hospital staffs and medical staffs are kind of strained just by all of it and all of the changes constantly. So, and she's somebody that I know that is a faith-filled person, but also somebody dealing with it on the front lines. So would you mind just kind of telling me about, or telling us about, what it's like or what it's been like for you these many months?
Yeah. So now that we're going on many months of this, it's kind of been day by day, honestly. It's been something that we've had to constantly being adaptable and changing to a constantly changing environment. Just because the science behind everything changes so quickly, and what we're learning about how to take care of patients with this particular virus changes so fast, that we constantly have to be very aware of what's going on and flexible and adaptable. And especially as there's been different peaks that have happened and things that have lulled and then they pick up again. And that changes what things happen in the hospital, surgical procedures that happen. It's just been, kind of constantly touch and go for everybody. And we're constantly flexing. So
And in the medical environment, it would seem that many times what you guys deal with is a lot of knowns, right? Or a lot of, here's how we do this, protocols that have come about over long periods of time. And now all of a sudden it's like throws something at you new almost daily, huh?
Yeah. Yes. And changing. There hasn't been a lot of things that we've done to treat people, but there are tweaks that happen. You're constantly having conversations of, we really think this is the right thing to do, but let me talk through this with you about a treatment strategy that, this hasn't been studied for long periods of time. So we don't have everything behind it, but this could be very helpful and beneficial, but we just don't know on the other end, which it's just a different way for us to practice medicine too.
Right. So you've had to care for quite a few people through these months, I'm sure. And has it taken a toll on you emotionally? It's different than all those other years of practicing medicine, I'm sure.
I think for the healthcare provider, it is just a different experience than anybody else, because not only do we hear about it in the news and people are constantly talking about it and the decisions about, healthcare providers that have children in school, but it's really what we're doing on a constant basis. And it's our work that's right in front of us. And so it's just kind of like, we can't step away from it. And it's always around. And it's when you're in the grocery store. So there's never a reprieve for the healthcare provider from it. So it's been,
I've never thought about that after you leave the hospital, it's still I know my daughter-in-law works with in the medical field as a social worker, and she drops her clothes right away coming into the house, and she showers, and just a whole bunch of things that she did not have to do before.
Right.
And
Yeah.
then thinking about it 24/7. Yeah. Have you found yourself having to put in a lot more hours? Are most of the folks in the hospital systems putting in many, many more hours, or?
I think some people are. We're not, our group in the beginning did shift our schedule to prepare for the first surge, just to kind of trial that if this got really busy, there would be this definitive backup plan in place. We didn't need to continue with that, so we kind of shifted out. And thankfully, we haven't had very many partners that have tested positive for COVID. So that hasn't actually, which is by the grace of God and amazing that we haven't had it. And
Yeah.
or we don't know we've had it, or people just really haven't been sick from it. So we haven't had to bring in extra coverage for us. We've actually been okay. But I know that, nurses may have had to pick up extra hours or be working in different areas than they're used to. Thankfully for me and a hospitalist in general, this is what we do. So we haven't had to change, but I know other people have had to adapt to different jobs in the healthcare system.
Yeah.
And have worked more. So.
Yeah. And I've read and heard on TV that even some of the executive people have had to go in and check temperatures at the door and things like that. Yeah.
Very
Yeah.
true. Mm-hmm.
Well, it's probably good for them to do that, huh? I won't let you comment on that.
Yeah.
I won't make you
a whole different experience. Yeah.
Yeah. Yeah. Well, I guess I really wanted to create this podcast for those who are in the healthcare profession and really help them, because we know from the statistics that depression, anxiety, just from being so tired and being exhausted, one's mental health and mood and overall affect can become drained. And here we are at this time of the year, and we're, holidays and facing another surge and difficulties. So talk to me about how you've have really worked at making sure you're taking care of yourself and taking care of your own mental health during this time.
Yeah. I mean, I think I've found that to be mission critical to continue on in my job. I think as we as healthcare providers are watching, we do have an inside look into the mental health of what's happening to people in the country, because we actually have access to people. We're not isolated from patients in the hospital. So it's right in front of us. And so it's apparent to me that if I'm going to continue on taking care of people, I absolutely have to take care of myself. For me, that's making sure that, I try to just create discipline and routine in my life, especially in this season of, one, making sure I'm resting enough. And then I make sure that I still get up and read and take personal time and do my devotionals, read my Bible in the morning. I've started listening to just the Bible while I drive into work, something that's calming, or biblical meditation apps when I'm calming. So there's something else that I'm thinking about other than a pandemic all the time. And so that my brain finds quiet and rest. And I'd also remember there's hope in something else, especially as we're facing more death. There's been so much fear that's come with this that we constantly have. Personally, I have to find grounding and remember that my foundation stands in something else, and that death isn't finality. And so even though we're seeing it a lot, that to me, so not only taking care of, resting, but my spiritual health. And then I run most mornings before I go to work. Sometimes it's 10 minutes, but it's a purpose of saying, what, I need to move myself. And then nutrition's really also always just been something that's been important. And so it's really focusing on, I I need to eat well because that does keep me going. So
Sure. Yeah. And then I think about the healthcare workers who then have children at home and are dealing with homeschooling and all kinds of things. I can't imagine what it's like to be living in that kind of world 24/7. I think it's really important for the discipline, like you said. That's what we tell all of the folks in Fresh Hope to begin with. If you have a mental health issue, you have to just make sure you stay disciplined. And sleep is the number one thing.
I mean, I work
Exercise.
out
Yeah.
a lot more, but I sleep more because I found that I I'm just more exhausted. And I think if you're looking at the providers, especially who are taking care of patients with COVID, they have now become, your providers become family, your providers become therapy, the providers become your friend, because there aren't many people. If you don't work necessarily in a COVID unit, in its limited access to the patient in the room, one, families can't come when they're isolated. So your family will be on FaceTime, but we're who you see in the flesh. And so, and it's been, to me, it like actually makes me tear up. I have watched nursing aides and nurses sit in these rooms with people who are dying, or just an elderly person who's confused in this. And it's like, there is so much hope in here. I mean, you get to see the true good in people that are walking in and saying, I'm going to sit with these people who have a virus. I'm covered in PPE, so I'm sitting in here, but these people need it. So I'm willing to go in and sit and hold this woman's hand because she's crying and she doesn't understand. And to me, those are like the beautiful stories that we do get to see on the inside.
Yeah. Yeah.
It's also, another layer of exhaustion for us.
Yes, because emotionally, that's another level of care that, not that you don't do some of that, but usually the family's there to take care of a lot of that.
Correct.
Yeah.
And also the concept that if somebody has the virus and is isolated, we're calling families to make incredibly difficult decisions that feel so impersonal. And I've found myself saying, I'm so sorry that we've never met in person and that we're making these decisions over the phone. And I don't know anything other than say, I'm sorry that we're doing this and that we have to do this, but this is what it is. And this is how it has to be. But I mean, we know it wears on the family. We know they're struggling and we are too, because this is.
Yeah, because you have it both between the patient and them, and then the care for one another. I'm sure that.
Absolutely.
Yeah, I really believe Time Magazine got a Person of the Year totally wrong. It should have been healthcare providers. So tell me, how has it challenged you, just in the sense of what have you found out about yourself through all of this? Because you were talking about grounding, because I can only imagine that in the midst of all of this, you've got to kind of push things away to figure out, okay, who am I and what really is life about? There will be life on the other side of this. What have you found out about yourself?
I mean, I think I always thought that I've always kind of thought I can do hard things. I'm resilient. But until you walk through something like this, and we're 8, 9, 10, no, more than that. Maybe 9 months into this, and you're thinking, I'm still showing up. I'm still doing this. I'm still going. It's like a different level of realizing we have strength that comes from something else, because on my own, I just couldn't, I can't foresee that we can keep going in this, but you do. We keep going and people keep going. And so I think for me, that's been, and
this is spoken by a doctor who's climbed Mount Kilimanjaro.
Yeah. I mean, but if you think about it, it was like, that's 9 days, and this was a lot of preparation, but this is just such it's such a multi-layered constantly, and I have to process it. And I mean, thankfully, I'm incredibly grateful. I married an emergency medicine physician in the middle of this, and this is both for our lives. And we try to, I mean, for each other's sake, keep some of it just so home feels a little bit more normal. But then also, we're a sounding board for each other of what are you going through, and do you need to talk about this? And both are willing to do it. So
yeah, I think that's also, you just made a very good point about processing it. You have to process it because that's pain, it's trauma, it's ongoing stress. You know, there were people that during the issue with, I forget, it was one of the small pandemics from Africa, and there were mental health care providers who were quarantined for 2 weeks, and 3 years later, they were still showing trauma,
right.
symptoms of trauma from it. So I can't imagine for if somebody's not, at least you got to be processing, getting it out, talking about it.
Absolutely. Absolutely. And you're processing in what feels like an isolated world. But for me, it's been finding the outlets, whether it's therapy on my own, to make sure that I am feeling what I'm going through. And I recognize that if I actually do step in and do some of the work to feel what I'm actually going through, I sleep better. I do better because I'm working through what's happening. So
yeah, that stress, that trauma has to go somewhere. And if you can get some of it out now, and yeah. You know, and two, I think the other thing that helps is the fact that taking, you know, they always say when you're going through difficult times to just take it one day at a time. But that's really how you get through things that are difficult in life, is it not?
oh my gosh, yeah. I mean, I think sometimes we think it's like an hour at a time that we're just
yeah, well, it can be.
Go get through the next. Yes.
And get through this shift, get through to the end of today, and then I'll have time to replenish. I'll have time to think about it. Yeah. I could only imagine. It's like being at the scene of a car accident 24, or you know, every time you go into work.
Right.
The entire time you're at work, I'm sure.
It is a different level of stress than it normally carries.
Yeah. So do you see fellow medical people suffering because of it? And how does that affect you on top of everything else?
Yeah. I mean, we do. I think you notice the exhaustion and the fatigue of people. I think one thing that's been important for me is to also remember, like, work is my interaction with other people in an isolated world. And thankfully I've got 20 some amazing partners who are good people. And so by the grace of God, for me, that's become some social interaction. And it's remembering for me to see other people, just see them, see what they're going through, listen, take time, because it's like the moments that people have just stopped to listen, because it's not just the pandemic. Our lives are also, there's other things everybody else is doing too, but our worlds are closed off. And I almost feel, you know, even just sharing from personal experience, when there wasn't as much testing going on and we'd find out, oh, maybe you weren't in full PPE and this person tested positive later, and now I'm going to isolate myself and my family from other people for 14 days. It became very isolated. It wasn't the choice to isolate. So.
Yeah, my sister, my brother-in-law had it and my nephew had it, but she never got it. And, but and during that time, she was in what she called COVID jail.
Right. Yeah.
For
Yeah.
like 6
Real.
weeks, she was in COVID jail,
Uh-huh.
nowhere, nobody, no, and I kept thinking, oh boy, just being locked up in my house with just those few. And then I ended up in COVID jail a couple of times. And it was
Uh-huh.
like, hey, I didn't choose this.
Right. Right.
Yeah.
Yeah.
So, yeah. And then you're cut off from work, but then you go to work and you're dealing with COVID. Yeah.
Mhm.
COVID. I'm sure.
So much
It's,
COVID.
yeah. Yeah.
Yeah.
So what's the first thing you're going to do when when life has gotten back to normal? Where are you going to go? What trip are you going to take? What
I
fun are
don't
you going
know.
to have?
Hang out with people. Like have a big group of people over something. I think for me, it's social interaction, hugging people without
Wondering.
wondering, are you going to get sick? Are we getting sick? It just feel, you know what? I miss seeing people's faces, like,
Oh,
and
I know.
talking it unmasked, as does the world. But so I think that would be good.
Yeah.
I want to do
And
something with a bunch of people.
oh yeah. Well, and now you see people with the masks on and they have different
Right.
things on them, and so I'm reading the mask instead of looking at their eyes. Or I'm like a little boy the other day, I saw he had like a Santa Claus mouth and beard. And I thought, okay, wait a minute, I'm going to run him over if I keep staring at his face or his
Yeah.
mask.
Yep.
Yeah. Well, I keep telling myself, okay, when this is over, I'm going to do this and do that, because I think that's what we have to do in order to preserve ourselves when we're going through troubled times,
Absolutely.
and make plans and enjoy thinking
Absolutely.
about the future, as
Mhm.
well as I think too, to laugh, to
Yeah.
just spend time laughing about some of the hard things
Yep.
sometimes. Yeah, well, we're going to have a thing, Fresh Hope is, and I haven't put word out about it yet, but I'm hoping we can get word out to the medical community, because we're going to have a short night of comedy online, and we're calling it a cup of cheer. And so we have some comedians that have done work for us, and this is just going to be, we want everybody to have a cup. You don't have to have a see-through cup. You can have a cup, and you can have whatever beverage of choice in that cup, but we're calling it a cup of cheer. And we're going to have like an hour of good belly laughing fun on Tuesday, December 29th.
Oh my gosh,
And so hopefully you can join us for that. But
this would be
to
great.
just say, everybody cut loose, okay? We're just going to have a cup of cheer together.
Absolutely.
And we're going to
Great.
forget about the world tonight, and we're just going to let these comedians entertain us and laugh,
Mm-hmm.
because life does have to go on. Yeah.
Yeah. Mm-hmm.
Yeah, I know. It's just so surreal, isn't it? Who would have ever thought? Of course, I mean, yeah, who would have ever thought?
Right.
So, what would you say to any fellow healthcare worker tonight or today that might be struggling? What words of hope and compassion would you offer to them?
Yeah. I mean, I think most importantly that there is hope and there is life beyond this. And I think even as healthcare providers who are exhausted, I mean, I think even looking at a vaccine is coming, and is that going to be perfect? No, but it's hope. And I think focusing on forward is a big, just really important place to keep hope and keep forward. And to me, I've started, and I ask the people in my own family, what do you find things to be grateful for today? Because there's so many hard, exhausting things, but I often ask myself, where did God show up for me today? What am I grateful for today? To try to actually fix my mind on something else and to remember that there's just something bigger, and we're a part of a bigger story than this, and this isn't going to last forever. And we don't know we don't know what's coming in 2021, and this has been 2020, and it's been a hard year, and we don't know what's coming in 2021, and so we get today. And so trying to find things that feel hopeful today and things we can be grateful for.
Yeah, that's very powerful, because I always tell folks ruminating, for instance, causes an electrical groove within your brain. When you think the same negative things over and over and over, it
Right.
actually is like a LP needle on an LP record. It digs in deeper and it can't get out. And
Right.
so you're exactly right to force yourself to think about other things,
Mhm.
to be grateful, to do some of the, and absolutely necessary.
Yeah.
Tell me about your faith, your walk with the Lord through all of this, and how that's been instrumental, I'm assuming, for
Mm.
you in taking this day by day.
Hmm. I don't, I mean, I think I've learned in walking through other hard seasons of life, there just is no other way for me. And um, I was just even telling my husband last night, it's so important for me to sit in the mornings and quiet and seek his direction. And I don't, it's some of this has been a drier season because it's been harder, but I feel like God has spoken a lot into trust me. Like, trust me, it isn't always going to be this hard. Trust me that I knew this was coming. I see what's coming. Just have faith in the plan moving forward. And for me, just still engaging in church and still trying to engage that community and making sure that I'm hearing and listening and being poured into in those ways helps me just engage my faith. And so to me, it really is everything. And it's the constant reminder that this isn't home either. And I'm yearning for something way better than
Right.
not just in COVID season and all things
Mhm.
of life, and that God has so much better prepared for us. And so,
I think about the fact that whenever I've been in Africa, and you've been to Africa numerous times, and what so often in this country, we have so many things we can count on, and life is
right.
very easy compared to. And this is just a little taste of what a lot of the world lives with day in and day out,
Yeah.
year after year.
Yep.
And so, it's part of that. Doesn't make our journey less difficult, but
Right.
it does kind of keep things in perspective worldwide, how grateful we can be for what we do have.
Yeah.
Yeah. Well, I want to thank you so much for doing this with me. I pray that it's helpful to those of you who are tired and exhausted and on the front lines of this, because for me, I've been trying to help other people along with their mental health, but I'm not having to gown up and walk in the room and deal with the actual virus itself. And those of you who are holding the hands and being there and have been there when people have died and poured yourself out emotionally and spiritually, I want to thank you from the bottom of my heart. And I know there's a whole bunch of us that are very grateful to everything and everyone that is putting their lives on the line and putting their not just their physical self, but their emotional self, and this is wearing. Stress like this is wearing on a person. It takes life away, so to speak. It can suck it right out of you. And so we're grateful. But Dr. Babbitt has had some great insights tonight. She's told us that it does matter that you stay disciplined and get rest and take care of yourself and be in the moment and grieve and work through and process what you can, but also just to do some normal things. Like, well, for me, normal would not be going out and running. Ain't gonna happen. You
That's
know,
right.
like they say, if you ever see me running with a pair of scissors, well, forget that. You're never going to see me running with a pair of scissors.
Yeah,
Just
absolutely.
isn't going to happen. But, my thing is that hold on. And I always tell people, just plant something for the future. Did you get your vaccination today by any chance?
I have not.
Do I need to call the governor's office so they get that to you tomorrow?
Yeah.
Oh, okay. I'm glad.
We start Wednesday. Yeah.
That in and of itself has to feel like hope.
It does. Yeah.
Yeah.
It does.
And thank the Lord that has gone like it has. And but I know in the meantime we just have to be safe and take care. So well, I promise this: when this is over, we'll have you and the other Dr. Babbitt that lives at your house to come to our house, and we'll have white cake.
Sounds amazing. That's so good. Thank
With
you.
no mask wearing. No mask.
Even better.
Yeah. Well, my problem is I have to wear a mask just to keep myself from eating food. Oh, Lord in heaven. I've got a new third grader attached to my hips, and I've got to get rid of that third grader before I start having to fly in airplanes again.
Right.
Yeah.
Grace for the journey. Okay. Yes. We've been close.
When all you do is you wear one pair of shorts the entire time that stretch, and this is not a good thing to do. Then on Sunday you go to church and things don't fit. Right. So anyway, but thank you so much. And for those of you who are providing care and you maybe need some support, or you just need to talk to somebody, we have Hope Coaches available. You just have to go on to freshhope.us, and our Hope Coaches would be glad to take a session or 2 or 3 with you and just listen. That's what they're trained to do, is just listen, as well as to help you process pain and difficulties. That also makes me think about those of you who are on staffs in hospitals and medical staffs, where maybe you have a Bible study or maybe you have something like this. When things slow down, we do have available a 4-session thing that helps processing stressful or emergencies together. And so it helps you process the pain and the stress and the difficulties and the trauma. And so just let us know, and it's free. We send it out, and we'd love to provide that for whoever would be interested. So, well, thank you very much. Thank you. I've known this doctor since she was a young girl. And so this is fun to do. Yeah, it just tells you that I'm really old. You're more mature and young, but I'm old.
No.
So, listen, folks, thank you for listening to this special edition of Fresh Hope for Mental Health. We do love questions. You can write to me at Pastor Brad at freshhope.us. If you have questions in regards to where to get help, how to connect with people, we do have online support groups also, as well as we have ongoing podcasts, videos, all kinds of things. You can connect with us on social media. And now may the Lord hold you with his perfect hope until the next time that we meet. I'm Brad Hoefs, your host, and this has been another edition of Fresh Hope for Mental Health.
You've been listening to Fresh Hope for Mental Health. If you have an opportunity, please review, share, and subscribe to the Fresh Hope for Mental Health podcast on iTunes or on the service that you use. We encourage you to share our podcast on social media with your friends and family. Previous podcasts of Fresh Hope for Mental Health can be found at freshhopeformentalhealth.com, iHeartRadio, Stitcher Radio, and iTunes. Fresh Hope is one of the leading networks of faith-based peer support groups internationally. For more information about Fresh Hope, go to freshhope.us.